codify a protocol that puts health first, that offers students who have found themselves in dangerous situations a receptive hand to reach for. It has taken years of work for us to reach this point, and today I am proud of what we have been able to accomplish. On behalf of the undergraduate student senators, I would like to thank Dr. Ratner, Dr. Zacher, and the University Senate for their continued dedication to this vital issue, and I applaud the forward-thinking members of our community who have enabled us to reach this point. Again, thank you.
Thank you very much. The chair recognizes the speaker on her left.
Good afternoon. My name is Cohen, and I am an undergraduate ESOP senator. Before I add my own comments, I'd like to briefly speak on the behalf of Student Body President Steve Glickman, who is currently testifying in Annapolis on our operating budget. Steve would like to offer his sincere thanks for all the students that have worked with him through the years on this issue, attending Senate committee meetings, meeting with administrators, and speaking to students. He would also like to thank the chair of the Student Conduct Committee for listening to the student concerns and allowing us to be a part of the conversation, much needed change. He believes that this issue is one of the most important ones that faces students currently, and I'd like to emphasize that the student body strongly supports this.
I recognize the speaker on my right.
My name is Alan Holmes. I am the Indian Staff Senator, and I urge everyone to vote for this. I've been a firefighter paramedic in this county for 33 years. I've run calls on this campus for students that have had alcohol overdoses. I've had to transport them to the hospital. I know what they're going through. You need to pass this. It needs to go through today. Thank you.
The chair recognizes the speaker coming up to the microphone on her left.
Yakov, Kronrod, graduate senator from RQ. I wish this policy was going further. I am going to absolutely support it, but I want to make it clear that I don't support limiting it to what the policy states now. I'm voting on it because I think once it's passed and recognized as a vital part of policy on our campus, it'll open up the discussion so that we can take it further to where it needs to be. I think limiting it, alcohol violations, I can understand is a very conservative move, and it's easy to get people to maybe support it because the 20 years old, 21 years old, it's easy to kind of draw that line. But just because we as a society kind of chose to endorse one drug versus another, doesn't mean someone in danger of a heroin overdose or anything like that should choose to let someone have harm come their way rather than calling for help. And the fact that we're going to put, prosecution of an individual over another individual's health is, I think, ridiculous, and it's really, it's important to recognize that, and I do plan on voting this, and I hope everyone does without a single exception, and I hope that we can, once it's in place, take the next step and actually do what I feel should have been done all along, and I hope it eventually will be. Thank you.
Thank you.
Let me point out that the Office of Student Conduct still has discretion in these cases, and so I don't think that we're implying that students who see someone in distress for a drug overdose shouldn't make the call as well. We can only handle certain aspects as policy right now.
Thank you for that clarification. Is there any other discussion? Seeing none, I would like to call for a vote on this. Those in favor of this policy, please press 1, opposed 2, and abstaining 3. Voting is open. Voting is closed. Passes overwhelmingly.